I'm going to talk about differences between kinship care or relative care and foster care. Just to start off, I have a few slides which are common to the other presenters. I'd like to acknowledge the traditional owners and also the other researchers who are involved with the project. And also confirm that this project, of course, did receive considerable ethical oversight. It's been approved by a number of different ethics committees. So the principal focus of my talk will be just to give you a bit of an outline about why we looking at kinship care. So why is it an important topic to look at, and how does it tie in with the Pockels study? And then obviously a summary of some of the major findings. I have far too many slides here to go through in great detail, but it might be the slides are made available to you. So I'll just highlight some of the most important ones for you, just to sort of give you a sense of what we found from these analyses. And then just a few sort of general conclusions about what we found so far from these baseline analyses of kinship care as it compares to other forms of care. So the principal Pockels question which this baseline analysis looks at is that one at the bottom. So Pockels has the capability, one of the few studies in the world, to look at how different exposures to different types of care over time might influence children's developmental outcomes. So we can actually see whether being in relative care over time or foster care makes a difference to how children are progressing. These baseline analyses I'm talking about won't contain any of that sort of analysis, but they give you a sense about whether there's any differences between the sorts of children you see in different types of care. So the reason why we're looking at kinship care, of course, is that it's a major form of care in New South Wales. In the past, it wasn't so, over 50% of care in New South Wales is kinship-based. It hasn't been a topic that's been greatly researched in Australia to the extent that it could be compared with overseas. And of course, we know that the children who are placed into kinship care do differ from those who go into foster care. Now, is that because there's different types of care experiences and different types of care, or is it the case that different types of children are deliberately placed in different types of care? That's a question I'm going to come back to a bit later on in the Q&A. It's a very important research question. And of course, maintaining the welfare of children in kinship care, even just recently there was talk about in Queensland about the quality of care, is a crucial part of policy. So this initial report I've written looks at the following things. It looks at the characteristics of kinship carers versus non-kinship carers, and it looks at the characteristics of children placed into those different types of care. Now, one of the particular things we're able to do with Pockels, which has only been done once or twice I think around the world, is that we're able to look at different types of kinship carer. So we know, for example, that not all kinship carers are the same. Grandparents are quite different in many ways from uncles and aunts who often take custody and care of children. So you can see here, my analysis was, using Pockels data, it was possible to separate out the grandparents from the other relatives. So it's uncles, typically uncles and aunts, who are carers, from the foster carers. And you can see some of the numbers there. The numbers, obviously, the largest numbers are, of course, in foster care, but we still have large enough samples across those three groups to say something meaningful about those comparisons. Now, what I'm going to do now is just go through just some of the highlights of the analysis we did, looking at the differences between the two types of carer, or three types of carer. There wasn't a lot of difference. Overwhelmingly, it was women who were carers across all three groups. Not a lot of difference in terms of cultural background, but Aboriginal carers are much more, well, other relatives are much more likely to be Aboriginal carers. So the category other aunts and uncles, other relatives, is confounded by Aboriginal status. So anything we say about that group probably has to keep Aboriginality in mind. And that's why we want to go on and do more work on Aboriginal carers specifically. And obviously grandparent carers are older. That's common sense. Not a lot of difference in terms of marital status, but the educational level of foster carers is higher. Typically, they're often younger and they often have completed higher levels of education. Although grandparents are more likely to report having raised their own children, more children. So grandparents are more experienced carers. Not a lot of difference in terms of employment, apart from the very obvious ones that grandparents are less likely to be in paid employment, because often retired. But these are the very interesting ones. Financial well-being. One of the key issues is how well resourced are kinship carers. And what you find looking at some of these statistics is that if you ask someone how easy it would be to raise $2,000 in an emergency, people who are in kinship care are much less likely to say, yes, we can do that. They're much more likely to say, also on the second question, that they're not very comfortable financially. So kinship carers, consistent with what we know, aren't so they're more financially vulnerable than the foster carers. And you see that both across both the groups. A comfortable 83% foster care, you can see much lower figures in the other two groups. Western comparisons, we didn't find any differences when you analysed the Western data in isolation. I just did this fairly quickly, but couldn't find any obvious differences between same sort of patterns emerge when you look at the Western data. You can see some of a couple of examples there. Household structure. On the whole, say reading out all those figures, typically grandparents and relatives are less likely to say our house is ready for additional children. Foster carers make a concerted effort. They actually made the opt-in choice to take in children. They tend to report having larger houses and greater capability to take additional children into the house. So that probably reflects some of your own experiences. Health status of carer. Fairly common sense findings. People who are older, so the grandparents, are more likely to report ongoing medical conditions that require assistance or ongoing professional support. And typically, this is the K10, the standardised measure of distress, and you can see relative carers, 14 to 14.2, significantly more distressed than the foster carers. They find this more psychologically demanding than do the foster carers. And you can see the pattern's actually slightly stronger in the West. When you look at just Western figures, 15 and 16 versus 13. The pattern's actually slightly stronger when you look at Western data. Neighbourhood variables. Typically, foster carers, I think, are most likely to give better ratings to their neighbourhoods. To say that my neighbourhood is safe, people get along with one another, people can be trusted, it's a good place to raise children, compared with the relatives. Once again, you've often had not to make the choice to become carers. Parenting variables. On the whole, grandparents reported having a more nurturing, less hostile style of parenting. That was interesting. And so, as you might expect, people who are related to a child often have a warmer relationship with the children. It's their own sort of, they're genetically related. And complex behaviour, grandparents rated themselves actually higher on that measure, which might be because I'll explain in a minute, the children are different. So I'm not sure what that one actually means. Now, not a lot of difference in the gender or makeup. Aboriginal children are more likely to be with the other relatives. That was a slight difference. It's consistent with the Aboriginal placement principle. There's more Aboriginal carers in that group as well. Child wellbeing. Now, one of the standardised measures we use is a child behaviour checklist, which of course is a very well recognised national measure of wellbeing. It measures internalising, depression, anxiety, externalising, conduct disorder, acting out, those sorts of behaviours. And this is where you see the importance of breaking down different types of care or kinship care. Consistently, what you can see with those percentages, this refers to clinical cases. That is, cases which are above a certain threshold score. And you can see that the kids who are placed with grandparents, a lower prevalence of clinical cases across both internalising and externalising compared with the other two groups. As you can see, the figures are up sort of 30, 40%. It should only be about 10, 15% in a normative population. Sorry. And you see similar figures as you move across the different age groups. Not quite so marked in a 12 to 17, but you can see other relatives are more similar to the foster carers. They're a bit different from the grandparents. And you can see this is some national figures. We're still trying to work on these sort of figures, get some good national comparative figures. But you can see typical national figures from normative populations are down the teens. So kids in care typically have a higher prevalence of clinical disorders of that sort of nature we talked about. Western comparisons, pretty similar patterns to what you see in overall. Age and stages, I won't get into much detail, but essentially grandparents once again had children who were doing better, higher raw scores. And that can be done in a more refined way using the other standardised scores. Cognitive functioning, slight small effect towards kids with grandparents also having slightly higher cognitive functioning as well. Relationships. Typically, the grandparents reported knowing the child better and having a much better relationship with the children than the other two groups. Yep. So you can see those figures are sort of scored, I think, in reverse. So it's, I think, a lower score means you're more likely to agree with the statement. It's always a little bit. So grandparents typically have better relationships with the kids. They're related to those kids. Western comparisons, pretty similar results to what you get overall. Slight difference towards Western carers saying they didn't know the kids quite so well. That could also be because there's more foster carers in the Pockles Western sample. That could be the reason for that. Good relationship with other parents, other family members. Once again, you can see the figures, the percentages there for grandparents much higher than the other two groups, typically. So grandparents typically get along better with the birth parents. Overall, as pretty common sense again, overall levels of family contact typically are much higher with grandparents. So kids living with grandparents are much more likely to see their parents have face-to-face contact and also overnight stays compared with kids in foster care and with other relatives. Summary and conclusion. What can we say about these results? Well, there are certainly clear differences between the two different types of carer, and that differentiating the two, I think, there's a paper by this guy called Andrew Zinn over in the US who indicates it's a good idea to do. Grandparents do, however, appear to be the most vulnerable groups with respect to their physical health, mental health, and also their financial situation. But kids placed with grandparents tend to score better on measures of psychosocial functioning, emotional functioning. As I said, we're not sure whether that's due to a selection effect. We put the easier kids with grandparents, or is it because grandparents do provide a more nurturing form of care? We'll find out that longitudinally over the next waves of analysis. But certainly there's no evidence from these findings that kinship care, as it's currently in New South Wales, is a lesser form of care than respective child outcomes. In fact, there's clear evidence that grandparents seem to have quite a nurturing relationship with the children compared with foster carers. But there is some ongoing need to sort out the confounding of the Aboriginal status with the other relative status. We need to find out more about that and look more in depth at Aboriginal carers. And clearly we need to track the exposure to different types of care over time, which we will do in our report next year, looking at the wave 1, 2 and 3 data. All right, I think I've reached 12 minutes. I'll leave it there. Thank you.